Good afternoon, everybody, and welcome to our Maven STD Information System Users Group for second quarter 2016. We're really glad you're here. We've got about 20 people on the line, and so that's a really great turnout. We've got a really full-packed call, but we always want to make sure that we have time for your questions and discussion. So we will make sure at the end of the call have at least 10 or 15 minutes for questions or discussion. So with that, let me go ahead and get going. My name is Charlie Ravens. I'm a technical assistant consultant with the National Coalition of STD Directors, and my partner in crime on this project is Marvin Fleming from the CDC Surveillance and Data Management Branch. Just a couple of housekeeping things. Please mute your phones when you're not speaking. We are not muting the phones on the conference, so that way if people have questions or we want to have discussions, we can do that. But with that, we need to make sure that everybody has their phones on mute, because if you're typing or somebody comes into your office and you have a conversation, we all can hear it and it becomes very disruptive. So we really need you to be vigilant about keeping your phones muted locally. Thank you. If for some reason my internet goes down, the call should remain, and Marvin should be able to step in. But just so if for some reason, there's a message that comes up that internet connection from the host is lost, just stay on and we'll get you reconnected. If you do have questions, you can always ask us using the chat function on the left. But again, we are going to have the phones unmuted, so feel free if you need to, unless we get we get too many questions. But you can always ask a question on the chat, and then we will, we can kind of address it then. So it's kind of your choice, whatever your preference is. Just as a reminder to everybody, CDC and NCSD are collaborating to support the Maven users groups, because we know a lot of you are out there developing systems and working with Maven, and it's great to be able to talk to your colleagues about, what are your challenges, what have you learned, be able to share best practices and solutions, as well as an opportunity to all of us to partner with Consilience and have a forum in addition to their users group, which is a little bit broader. This users group is specifically for STD programs that are using Maven. So before we do the agenda, Marvin's going to go ahead and do a quick introduction and roll call. So Marvin.
Sorry, I had my phone on mute. Okay. Hello, everyone. My name is Marvin Fleming. I'm part of the Surveillance and Data Management Branch, specifically the Informatics team. We're going to do a quick roll call of the project areas, and then we'll see who's on the call from CDC as well as from Consilience. Anyone on the call from Chicago? Okay, Connecticut.
Yes.
Hawaii?
Yes.
Massachusetts? Minnesota?
Yes.
New York City?
Present.
North Carolina?
Here.
North Dakota?
North Dakota's here.
South Dakota? Texas?
Here. Here.
Virginia?
Yes.
Washington State?
Here.
And Washington, D.C.?
Present.
Thank you. Who do we have on the line from CDC?
Evan O'Connor.
Hi, Ninad is here.
Hi, Dee is here.
Hi, Kristen Kreisel's here.
John Corsi's here.
Alicia Harvey.
Okay. And who do we have on from Consilience?
Michelle's here.
Thank you. You want to go ahead and continue on with the agenda, Charlie?
Sure, great. So thanks again. We have, for having a great turnout. Hopefully this call is going to be very worthwhile for you. Again, these calls are kind of for you guys. We're here to sort of help. The agenda is like we've basically done the welcome and introduction roll call. I'll do a really quick update from NCSD. Marvin and Alicia are going to give us an update from the surveillance branch. We'll have a chance for Michelle to either do a quick presentation or answer any questions from our users. And then our special presentation is from Clear Low, who's going to be talking about implementing STD information systems. And then we'll make sure that we have at least 10 or 15 minutes at the end for people to raise issues, challenges. Maybe somebody can have a question or a challenge that they're having somebody else might be able to address. And then we'll wrap up and have next steps. So let's move on. And the NCSD update, NCSD is continuing to support both the Maven and prison groups. We really believe it's, we hear a lot from our members about all the challenges of starting your own system, supporting it, keeping it going, enhancing it. And so, we're here to help provide technical assistance, primarily to help you link up with somebody because, we don't really, know the systems, but I think, we have experience. As well as when needed, we get the vendors involved in other issues. So, we're here to help you. Our big issue is we've just started planning for our annual meeting, which is going to be in Phoenix next December. And one of the things we always try to do is usually have 1 or 2 sessions on surveillance and sometimes even a pre-meeting, 2 or 3 hour extensive session on surveillance. So if anybody has any particular issue related to surveillance or their data system, whether it's Maven, Prism, or something else, and they feel it would be a really interesting topic or they're doing something very innovative that they would like to share, that would be a good forum. And you can always email me, and my email address will be shown at the end of the presentation. So that's pretty much it from NCSD, and so I'm going to turn it over to Marvin, who will kind of kick off the surveillance branch.
Okay. I just have a few updates myself. Just a reminder, the 2016 STD Prevention Conference scheduled for September 20th through the 23rd. The abstracts must be submitted electronically no later than Monday, April 25th at 11:59 p.m. Pacific Standard Time. Abstracts sent by mail, fax, or email will not be accepted. The next surveillance coordinator's call is scheduled for Monday, May 9th at 1 p.m. Eastern Standard Time. Not a lot to give you on the message mapping guides, basically just that they are currently being piloted in several states. For an ELC update, as a reminder, under Attachment C of the Epidemiology and Laboratory Capacity for Infectious Diseases Funding Mechanism, activities are being solicited to improve health information system capacity. Sustaining or enhancing integrated surveillance systems that include STD surveillance data is specifically mentioned. Automated STD ELR reception and processing, especially for gonorrhea and chlamydia laboratory reports, remains a priority. And preparing for electronic case reporting is also mentioned as a potential activity. We encourage you to work with your ELC coordinator to take advantage of this funding opportunity. And that's it for my updates. But we are very fortunate to have Alicia Harvey join us on the call today, and she is part of the data management branch. But before we get to Alicia, as we normally like to do, we're going to do a couple of poll questions. Our first poll question: has your STD program finalized your 2015 STD surveillance data? The responses are yes, no, unaware of closeout date, don't know, and not applicable. Please go ahead and mark your responses now. Okay, it does look like a slight majority has submitted their 2015 data. And our next poll question. Has your STD program sent CDC a final 2015 year-to-date file? Yes, no, don't know, not applicable. Okay, and it seems that the majority has not sent their final 2015 data file. With that, I'll turn it over to our next speaker, Alicia Harvey, please.
Good afternoon. The good news is that the final closeout file for 2015 is not due yet. For those of you that do not know, the due date is going to be next Friday, April 29th. And, of course, if you guys run into any problems before then, please contact me as soon as possible. Most of you should be receiving the STD quarterly reports and the NETS edit check reports. Please be sure to review these reports and clean up your data throughout the year. The edit check reports kind of provide like detailed information about invalid values and illogical checks. Some states have lots of records with date issues, but we do not expect you to be able to correct all of these items. And if that's the case, you can just kind of leave the data as is. You're not penalized or anything for items that are still left on those edit check reports. It's kind of things that we just kind of want to make you aware of, but it doesn't mean that they're all errors, okay? And for those of you who are not receiving the reports and would like to receive the reports, you can email me at aharvey@cdc.gov, and I will add your name to our distribution list, okay? Frequently we receive public inquiries for our STD data, and occasionally we get requests for STDs among children like less than 10 years of age. We want to ensure that we're providing the most accurate aggregate data as possible. Therefore, we are asking you to verify the cases with persons 0 to 9 years of age, and that's what Marvin has on the screen. So this table, which is by state, by disease, with the number of records reported for ages 0 to 9. So we're asking that you please double-check these data by verifying the ages and try to clean up as much as possible before the final file is submitted on April 29th. Okay? In the recorder reports that we provide, we include a table that gives like percent of unknown, missing, and invalid values for specific variables. Today we're just going to focus on the PNS syphilis, and the variables that we're going to look at today are county and sex partner data. The numbers in the tables today will just only represent the percent of missing, unknown, and invalid values. I do not show the actual number of cases. However, if you would like to know the actual number, please feel free to contact me. Would have just made the slide a little busy to have all those numbers on there. County is very important because we consistently provide data by MSAs, and these MSAs are created by combining county-level data. Again, here the good news is that everyone is doing an excellent job of providing valid county codes to us, and so that helps to make sure that we're providing data at the county level as best that we can. Next slide, Marvin. Sex partner data is another variable that is frequently being analyzed by our epidemiologists. This data is required for syphilis and optional for other STDs. And so you'll see here there's a little bit of work to be done, and I know sometimes it varies by system, but we're just asking that as that data is starting to be used more and analyzed more, that you kind of will complete that data as much as possible. Okay? Transition, we want to just say a quick word. Some of you have already transitioned to Maven. Others of you are on the timeline for upcoming transition. As you transition from your current system, please contact me, because what we want to do is to actually have you send a test file from Maven so that we can review the file and look at the edits before you actually start sending the data to the MMWR office. Because once you send that data there, that data is the live data. In some instances, we've had like data that wasn't quite ready for showtime to go, and it would have been published, in like MMWR. So we want to kind of do a test, give feedback, and then as you work with your developer to like make additional edits or whatever to the data, that when you actually do your official reporting weekly, then the data is good. And we also ask that you send a year-to-date from your old system before you make the switch. If you happen to transition to Maven in the middle of the year, please keep in mind how you will create a year-to-date file at closeout. If all your data is being migrated to Maven, then we should not have a problem. But there are some instances for states that may not do migrating who may switch, say, like in June or July, and the first half of the year is in one system, the other half is going to be in Maven. Well, when we get to closeout, we really need a year-to-date file, and so sometimes people don't, always think it through. And so we have problems because we have to go and get the old data, concatenate it with the new. So think about that, if you will, but if not, make sure you give me a call just so that, we're involved and we kind of be proactive in thinking of the solutions to these, okay? Again, contact me if there are questions, and I thank you.
Thanks, Alicia. Maybe we'll spend 2 or 3 minutes. Does anybody have any questions about the closeout file for Alicia or Marvin before we move on? And if you do, make sure you take your phone off mute and ask. So we'll wait about 20, 30 seconds to see if anybody has a question. While we're waiting, again, I think one of the things that came out of the SIG meetings is just the really importance of looking at those quarterly reports that they send out, because we definitely identified some issues where what people thought the data was coming down the CDC was quite different than what people had locally for some project areas, not all. So I think those reports are really a valuable resource to everybody to make sure they're all on the same page and that our data is as accurate as possible at both at the state and the CDC level. All right, so hearing no questions or issues, we're going to go to our report from Consilience, or a chance to ask questions. So, Michelle, take it away.
Are there slides beyond that one?
You didn't send me any slides.
Right, okay. Just checking, because I was like,
okay.
I didn't send that. I don't have any specific updates that people on the call don't maybe already know. We're still in planning for the MUG conference, which is going to be in August. The dates are August 4th and 5th. It's going to be in Boston this year. We're diligently working to get 542 out the door, hopefully ASAP, and 6.0 should be coming out at the end of Q2. So 6.0 will have lots of great enhancements in it when we finally get it out the door. But otherwise, I don't really have anything specific unless anybody has questions or comments for me.
Can you briefly mention what some of the enhancements are, if it's not too premature, on 6.0?
The one that I am most excited about is the user preferences, which will allow users to, for example, specify which workflows they have on their splash screen, and they'll be able to kind of customize Maven so that it will continue to look like they want it to look, as opposed to a standard view that everybody sees.
Great. So does anybody on the call have any questions for Michelle? And we'll wait for about a minute. So I think that's a good sign. I mean, I think obviously we're not hearing too many complaints or issues, so that's usually what generates a lot of stuff. I'm sure Michelle is quite accessible to people if they have questions, or there are other people on staff at Consilience that can answer stuff. But hearing no issues, and if you do have something that you think of once we start our next presentation, feel free to put that question or issue on the chat feature, and then we'll either mention it when we have a break, or we can shoot that over to Michelle. So moving ahead, our next discussion is going to be a presentation from Claire Lowe, and I'll let Claire introduce herself. But on implementing STD information systems. So Claire, take it away.
Hi, everyone. This is Claire, and I am not seeing the. Oh, there we go. To advance. There we go. So I was the Public Health Informatics Fellow in the Division of STD Prevention, the Surveillance and Data Management Branch in 2013 to 2015. So last summer I finished as a fellow there, and I'm currently a Public Health Informatics Analyst, a Senior Informatics Analyst at the Public Health Informatics Institute. So the work that I'm going to be presenting today is about my capstone project as the fellow. So some of you may have been people that I interviewed for this project. So I'm going to review quickly the background. I think this group knows the background of STD surveillance pretty well. The methods that I use, some results and recommendations. So as you know, CDC is trying to reduce the number of siloed systems, and at the same time, DSDDP isn't updating full updates of the SCMIS software, and they're encouraging adoption of standards-based tools. And so the states are transitioning to integrated surveillance systems, and some have requested assistance in choosing STD systems. So the goal of this study was to assist states in decision-making for selecting STD information systems. And while in the study I looked at all of these, looking at different system requirements as well as rating systems, what I'm going to talk to you today about is, it doesn't have my, I have some animation, but anyway, the second bullet there to describe the process of states who have selected and implemented new systems. So the STD information systems that are available, the most common ones, are presented on this screen. And of course, we do still have the STD in MIS, and there's the new MBS STD module, Maven, Prism, Trisano, and then the NEDS compatible systems and the built in-house systems. So we wanted to find out what we can learn from the states that have already adopted systems. What is that experience like, and what can we have as lesson learned for others? So that I conducted interviews with the state STD programs, mainly the administrators of the programs, in 7 different jurisdictions, as you see on this slide. So what I'm going to present to you isn't Maven specific per se, because what I found was that in terms of implementation, the system was not necessarily the important factor. There are various other lessons learned that are applicable across systems. I conducted semi-structured interviews over the phone, and I generally conducted group interviews because I certainly understood that there would be a range of experience that would be relevant to the questions. And from those, I developed some rough transcripts of the interviews and then analyzed those based on themes. The interview protocol itself looked at selection and deployment. I asked questions about what components were included in the systems and their satisfaction with those components, what impact that it had on the overall program activities and data quality, and then the lessons learned in general in implementation. And the themes that came out were in selection and contracting, implementation, maintenance and enhancements, and impact. And I'm going to go over each of these lessons learned. So the results on selection and contracting were that most STD program staff were involved, mostly STD program staff were involved in selecting the systems, but they were less involved in contracting and developing the scope of work for the contracts. The IT, on the other hand, often led the selection process and the contracting. And STD programs felt like their needs weren't often prioritized among all of the needs of the programs in the health department. And after the go live, there wasn't a lot of support available unless it was specified in the contract. And when you think about that in terms of the lessons learned, so we encourage SD programs to foster a relationship with the IT. I think it was on both sides that STD program staff didn't see that they had a role to play in some of the contracting. But I think if there's more, let's say, if you go out of your way to foster these types of relationships with IT, then you can see where your input can help with the contracting process as well. And it's important that STD program staff are involved in every phase, including contracting and implementation. Before going live, it's important to consider everything that the system must do. And I'll just note here that the organization I work for, the Public Health Informatics Institute, has some tools on our website that are free for download for actually defining requirements for your system. So if you want to look at that, and also there's some lists of requirements that might be useful. So that's phii.org if you want to look at some of those. Another lesson learned is to be sure to include functions critical to STD in the vendor scope of work. And I think that often STD finds itself has a few unique functions needed, particularly in terms of partner services, that aren't always recognized by other epidemiology programs within the health department that are in communication with IT. And then finally, make contracts phased so that the implementation is iterative and the contractors can be held accountable. So some of the people I interviewed had put everything up front, and once they started using the system, they didn't have an opportunity to come back and said, wait a minute, this in practice this isn't working. It worked in testing, but it didn't work in go live. So you can develop your contracts in a way that you can come back and have an opportunity to improve the system after it's been implemented. So speaking of implementation, so these were the main results for implementation. And so some SD programs rolled out all at once and some were phased, and I have some examples of that follow. Full implementation took many years. Implementation involved both testing and training as well as rollout. It was important for some groups when they had detailed iterative testing plans, they found that really paid off, while others didn't have a clear plan for that, and they were the ones left with trying to get things done after the contracts had been completed. Some folks migrated their data, their historical data, and some did not. It's not an easy thing to do, and there were issues with data quality. But those who haven't migrated their data also have issues with maintaining a historical system from which they look up historical data. So you need to weigh the benefits of migration. So this is an example, a couple of examples of the time frames. One is a short time frame and one is a longer time frame that people use to implement their systems. I think it's important to note that it's not about what system, because Prism was, in this example, was deployed a little more quickly, but that's not an effect of the system, but rather how it was planned to be deployed. So the lesson learned are that this time frame really needs to be planned for. Several of the staff commented that they were having to maintain their full jobs as well as be responsible for implementing a new system, and that caused a lot of stress, and even some staff left because of the added pressures. So it's important to plan and allot for the staff time as well as planning the process and the rollout. Test the system thoroughly with users before it goes live, and so test with all of the users. If your locals are, if the local and county folks need to be trained, be sure to test and train with them. Again, it's harder to fix things after implementing them, and you need to involve people at multiple levels, as I mentioned. So another theme was maintenance and enhancements. Generally, this was a shared responsibility among program staff and in-house IT staff, as well as vendors and contractors. Very few of the folks that I talked to were very satisfied with their ability to get changes implemented in a timely fashion. For some, the enhancements were a cost issue, so this needs to be considered ahead of time. If you're going to need some changes down the road, is the funding in place to do that? And then at the same time, some were telling me that now the systems are changing and they are more customizable at the user level. And I believe Maven was one of the systems that was allowing for more customization at the user level. This is a quote from someone. This is, again, a Trisano user, but the system itself is less important than the experience. So they said the downside so far is not so much because of the system, but that our needs are deprioritized. For example, we were not able to report our partner services data for 3 years. We can report it now, but we couldn't. This is, again, an example where you need to be clear up front of what all your requirements are going to be. Another quote, "It would be good to have a person who could sit down with us and create specifications and so forth, and then go to agency IT staff to make the change." So this is a workforce capacity issue of not having the right informatics knowledge to be able to articulate the specifications needed. So the lessons learned on maintenance and enhancements are to develop an understanding early with IT and contractors about how maintenance happens. Again, after the contract is for implementation and deployment has ended, then what? Designate STD program staff time and hire informatics staff to help with these kinds of enhancements. And finally, look for customizability or ask for customizability by program staff when selecting systems or when upgrading your systems. And finally, in terms of impact, and these are sort of some overall lessons learned that came out of my discussions with folks. And in terms of data quality, I asked them specifically whether data quality had changed, and they did feel like the timeliness of the data was improved, but that there were data volume issues that had to be handled, and it meant that deduplication had to be more robust. There were a lot of changes in workflow, and sometimes this wasn't anticipated, but particularly data entry staff had to be retrained for new skills, and a couple of the folks I talked to had put that energy into quality assurance, but they said it meant that some of those data entry staff didn't feel up to those types of skills and weren't comfortable doing them, and so some of them left. They also found that they needed new positions, and higher salaries might be needed with new positions. And then they also found that there were some duties that got shifted to the local agencies. And so again, you need to be clear about what you need, what kind of training do your local agencies need. And then finally, the issue of funding came up a lot. And with the new systems that cover many different conditions, it's important to figure out the funding across programs. So there were certainly limitations to this study. It was a small sample, and as I said, the systems are highly customizable. So one implementation doesn't necessarily look like another. And then my tools, when I say untested tools, my interview protocol was not tested beforehand. So I'm going to, these are just some conclusions I have, but I want to go ahead and open it up for questions. I hope we still have time for that. I know I took a little extra time, but it looked like there was some time available.
Yeah, I think we have about 5 minutes for questions, Claire. So, thanks for your presentation. So let's open up the field. If you have a question, unmute your phone, ask Claire the question. I think the other thing is if people want to sort of comment on Claire's presentation and maybe one of the biggest lessons they learned when they were implementing Maven, that might be helpful to other people, especially those that are sort of, in the development stage. But if you could do one thing over again, maybe what would you do? I'll open it. Go ahead.
Sorry, this is Michelle. Who do I have on the phone from Virginia?
You have Nihar, Steve, Rachel, and Rochelle.
Oh, okay, great. Do you mind if I use you guys as an example here for a second?
Yeah. Go ahead.
So Claire mentioned in her talk here that rolling this out iteratively would be helpful, and I'm really fascinated by the idea that Virginia has of how they're going to roll this out. So I wanted to share it with other people in case it might be something that you would also benefit from or be interested in. But their intention, and correct me guys if I get this wrong, because it's been over a year since we talked about it. But their intention is to roll out Maven such that the initial users are only the people at the state office, but they're going to give read-only access to all of the local agencies so that they can start becoming familiar with where questions are and they can start looking at cases and stuff like that. But then they're not going to necessarily be expected to do anything in Maven until sometime after we've had sort of a proof of concept with the central office people. And I think, if I remember correctly, your guys' local people don't use MIS right now. So this will be kind of brand new for them because they've never really even used a system at all, if I remember correctly. And again, guys, help me out if I get this wrong. But I think that that's really kind of an interesting way of rolling it out, and I'm kind of excited to see how it goes.
Yes, that's correct.
So maybe somebody from Virginia can kind of comment on, sort of why you're taking that approach.
No, this is Nihar from Virginia. I was just trying to respond that whatever Michelle said is correct.
Okay. Other questions or comments from Claire, or other people want to share like a lesson learned when they were implementing it or deploying it?
Hi, this is Robin from New York, and I would actually like to sort of piggyback on exactly the idea that Michelle brought up, and I believe that Claire had it in her presentation as well, and that is if you can roll it out in pieces and try to learn at each of those pieces, because at least our experience in rolling out Maven was the first 3 months after we implemented was probably more intense than any of the other times in learning all the errors and mistakes and expected mistakes and expected ways that things didn't work the way we thought they would. And it was so much harder to get all those changes made and fixes made while we were actually live in production. And so if I were to do that over again, I certainly would have done it in more stages and tried to have doing what Virginia's doing, deploying to a certain group and then having people work on it and then perhaps making it live for others.
Great comment. I do know, like when we rolled out a system in Illinois, it was not Maven or Prism, but it was like an EDS-based system. We initially just did chlamydia and gonorrhea just because we felt like the complexity of trying to do syphilis with all the permutations on determining what a case was and all the different test results and all those permutations. And it actually benefited us because it took us a year or two to just work out all the kinks and really get a good workflow and system flow with chlamydia and gonorrhea. And then we could sort of, once that was under our belt, then sort of take on syphilis, which took another year or two. So did anybody take that approach at all? Okay, so any other questions for Claire on implementation or lessons learned, or if you had to do it over again, you'd do something differently? A lot of times I learn a lot from sort of what didn't work, so I think there's no shame in talking about something that didn't go right, but then you were able to benefit from that lesson, or maybe you didn't have to repeat it because a colleague did that, and I think that's one of the benefits of this group is that we can learn sort of from each other and what didn't work for us, so somebody else doesn't repeat it.
Hi, this is Garrett from Washington, D.C., and I just want to make a comment about relationships with IT. Hello?
Yeah, I think unfortunately somebody must have put their phone on hold, and we're hearing their hold music, and this is one of the dangers. But if you could kind of talk louder, I think we can hear over you. Sorry about this. Yeah,
I wanted to say that the relationships with IT, us have a relationship with our IT, and the idea about priorities. For me, it's like priorities shift because of what I guess department, not necessarily what program needs are. So that could shift what IT focuses on. It's not necessarily coming from within the relationship. It's more about what's driving the overall department goals.
Okay, great.
Go ahead. And talking about higher informatics staff, that would be great. Like everyone keeps mentioning, funding is an issue.
So this is Claire, and I would just say that I certainly realize that the funding is an issue, and one thing that I hope with the report, which has a lot more detail, maybe can be a way to advocate for that kind of thing with those who have control over the funding. And also, I just want to invite you to, feel free to contact me separately with questions if you have them. My email address is, I should have thought to put it on the slide, but I didn't, but it's cloe@phii.org.
Could you repeat that, Claire?
Yeah, and we'll
Sure.
go ahead and type it in a message. Go ahead.
Sure, it's cloe@phii.org.
Thank you, Claire.
Okay, I will send this out to everybody. Okay, great. Thank you for that presentation. I think it just, a good reminder of we can learn from each other from both what works and what doesn't. And so now we always want to make sure that we leave time on our calls to give a chance for people that have questions about, I'm running into this problem. Has anybody else got a solution? As well as the opposite, if you've done something that you think is innovative or interesting that you think other people might be interested in hearing about, And we don't consider it bragging. It's really sharing sort of something that you're doing that we should consider, or maybe really a lesson that you learned. You tried doing something and it just totally didn't work, and maybe somebody has a solution, or maybe that will prevent somebody from going down that same road. So if you have a question or want to bring up an issue, please take your phone off mute and ask away. So we will have some silence while we're waiting.
I would also like to add that if you can't think of any questions, we're definitely open for suggestions for presenters at the next meetings and topics. So this is a good time to discuss those as well.
Hi, this is Garrett again from Washington, D.C. I guess I'd just like to make a somewhat of a lesson learned for my perspective. I'm relatively new to the whole STD surveillance and prevention world. I've only been doing it for, I think, less than a year. And in learning how our STD team is using the system and what work they need to do, I think something that I learned is what was tried here in DC was they were trying to recreate STD-MIS in Maven, which was probably not the best approach. And I'm not sure what approach would have been better, but some of my thoughts were that it should have been more based on what the different positions were and what their job functions are supposed to be, and so we're kind of struggling trying to fix our system to make it work for our users better.
Can somebody kind of comment or give Garrett a suggestion on maybe a different approach that their program took when they were going to implement Maven? Sort of what they based on it? Was it something like, what are the questions we need to ask or answer, and then base the system on that? Was it looking at the CDC requirements for nets and building it around that? What did other people do to sort of address Garrett's issue?
Hi, this is Robin. When we were developing the questions we were going to ask, I had, I think, about 4 or 5 sort of protocols or data dictionaries sitting around me. I had the NETS data dictionary on one hand. I had the data points that HIV required. I had the data points that our partner services folks required, and probably a couple of others. And each time we would come up with a question, I'd look through each of these items to say, okay, well, our question and our answers have to satisfy all these different people that we need to report to throughout our system, and will they satisfy? And we had to come up with some interesting ways of asking questions so that we didn't have to ask them all multiple different ways. But that was my approach, to just make sure I had an answer to any question someone might ask me down the road.
Great. Thanks for sharing that, Robin. How about other people? How did you approach building the system and designing it?
Hi, this is Nancy Barrett in Connecticut. And we're just getting our STD models that's going into our CTED system, that our Maven-based system, finishing with the modeling part. And a couple of things we did that I don't know if it helps somebody who's even newer than us to using Maven for STD. Well, we did some business requirements gathering and looked at existing workflows and processes. And we talked a lot with the program staff who've been involved heavily every step of the way. Because because we're working with the vendor Consilience directly plus program staff. We don't have any of our own IT staff involved because we happen to maintain our CTS system primarily on the program side in our infectious disease section. So one of the things we did, and then working with Consilience also, is we did a lot more business analyst kind of work with workflows and trying to identify processes to get people thinking about what they'd like the system to do as opposed to what it did before. And then we also looked at other people's systems, New York's, we looked at North Dakota's, we looked at the Texas system. So we're trying to, because we're a little later on, try to kind of get some good ideas from what other people had already done. And then we also have had to build against our base CTED system because it was already in existence. So I'm the contact for that. And so when things would come up like, why don't we build a new reference list or use a new question, I'd be kind of the one saying, no, let's go see if we have one of these questions first. So we tried to align a lot to the base system that we're going to be integrating the STD module into.
Great advice. And just I'll put a shameless plug in. I think one of the things that we sort of have suggested and advocated is if people could post their data dictionaries up in the NPIN Maven users group, that when people like Garrett or others are designing your system, if they could look at what other people's data dictionaries are, they might be able to, number one, get an idea of what variables they should be collecting, and number two, really maybe save a lot of time in recreating the wheel to be able to say, hey, this is what works, and then if they're interested, then they can reach out and talk to that person. So we would really encourage everybody, if you can, to either post, a data dictionary, maybe a link to where it's at, or something about your data dictionary. Maybe Michelle can speak to that. Are there ways people can, do people know how to export out their data dictionaries from their system and print them out, or as a PDF or things like that?
I dare say yes, they do. I'm pretty sure everyone on this call knows about the model print report that they can run. So if anybody doesn't know about that, feel free to reach out to me directly, and I will happily walk you through it. Because I think it's a great resource, and I agree with you, Charlie, that it's a good idea to go ahead and publish these things, although I will put one slight caveat on, which is even if you have the data dictionary, still a little bit tricky to understand exactly what's happening and how it looks on the screen, because we don't show all of the conditions about when questions show or don't show in this report that I just mentioned. So it's a little challenging without actually seeing the system, but it would be a good start, because you could certainly look and see what the questions are, and then if you had if a person had questions, they could contact the state or jurisdiction directly and ask if they could demo parts of it or things that seem interesting to them, or of course they could contact us as well.
So they can generate. Can they generate those as a PDF?
Yeah, it comes out as an HTML file, which usually gets opened in Excel, okay. But you can certainly save the Excel file as a PDF.
Great, because I think, again, people could post either a PDF or the Excel file or some file that's very easy to post up an NPIN. If you need any help, Marvin and I can help you. But I think that's one of the things we really would like to encourage people to do. Are there other resources that people can sort of export or print out from their system, Michelle, that you would suggest would be good references?
Maybe. It may be that it would, okay, sorry, backing up. When one prints out that report, one has the capacity to specify how many answer options show. So for example, if Texas was to print out that report, they could say, okay, I want to show 20 answer options, or they could say I want to show 500 answer options. And 20 answer options, when you get to a county question, would only show you 20 counties. But if they said 500, then it would show all 254 counties in Texas. And if you show all of those answer options, it's really hard to read the rest of it because there's so many answer options, it's hard to see all the questions. So I typically recommend having a very small number of answer options so that somebody can kind of get a gist of what the answer options sort of are. But then you may want to have, we also have a file called our reference code file, And that may also be something that we would want to put out there so that people can see the rest of the answer options if they wanted to.
Great. Other questions or other?
Well, before we go on, I'd like to, Claire put a comment on the chat. I'd like to go ahead and read that out loud. The report from her study includes a tool that defines requirements for STD systems. There are also tools on the website phii.org. Specifically, search for EDSS Vendor Analysis Report. On the EHR Toolkit, there is a requirement development tool. And I would like to mention that I did include the entirety of Claire's report when I sent a meeting reminder last week. But if you no longer have that email, let Charlie or myself know, and we can make sure to get you a copy of Claire's full report.
Great. Thanks, Marvin. All right, so we're going to wrap it up in a minute, but just a couple things we want to make sure people are aware of.
Charlie, real quick before you wrap up, can I say one more thing?
Yeah,
Sorry,
go ahead.
This is Michelle. One thing that I highly, highly, highly encourage and honestly can't encourage enough is to please try entering data in the system before you accept the model. Try entering actual cases with not actual names so that you can make sure that everything that you need to enter is there and everything works the way you expect it to work. So I have probably told every single customer that, probably repeatedly, but it bears repeating yet again.
Great. I know we definitely learned that lesson. So you might think it's going to work, but once you start doing it, you realize you're missing some key variable that you thought, that you sort of overlooked. So, great suggestion. So a couple of next steps and action items. As you know, we do have a user list by project area, and this is really a resource not only for us, but for you to help you identify how long people have been using Maven, sort of what they're doing in it, and especially what's useful is the contact information about people's email address and phone number. So we know this list gets out of date. People leave, new people come on. And so Marvin and I will send out the spreadsheet. If you would just take a minute when you get it to look at it to make sure the information for your project area is correct. If somebody's left, tell us and we'll take them off so that their emails don't keep getting bounced back. Also, we noticed that sometimes not all the information that was provided initially, so maybe somebody's phone number is missing or your title or something like that. So, again, because once we get that list finalized, we post it up on NPIN, and that, again, it's a resource for you. If Virginia's doing something or New York City's doing something, or, you need to get a hold of Garrett in D.C., it's a great way to sort of reach out to your colleagues, because that's what we're really promoting is peer-to-peer technical assistance and learning from each other. So please do that. If you have any topics or discussion questions for future meetings, these meetings are for you, and I think the more people raise questions and raise issues, we can learn from each other in a great discussion. We encourage everybody to use the NPIN site as our sort of resource sharing tool. Everybody has access to it. If you haven't signed up for NPIN and you need, if you have questions about it, and especially on the Maven users group, contact Marvin or myself, and we'll tell you how to get in the group, because not everybody who's on the users group is in the NPIN and vice versa. So we want to make sure to do that. This session has been recorded, and usually within about a week after the session, we will post the recording as well as any of the slides up on NPIN. So it'd be a great way for people to get stuff. So got about 1 more minute. That's cutting it pretty close. Really appreciate the great participation from everybody, and continue. If you have any questions or stuff, contact Marvin or myself, and we'll see if we can link you up, as well as talking to Michelle at Conciliant. And so hope everybody has a great day and keep on using Maven. Thanks, everybody, for participating.
Thanks, everyone. Don't forget the closeout, April 29th.
Thanks.
And if you have any questions, here's our email address. So talk to everybody later. Bye.